So this afternoon we're going to be doing some cheek augmentation on Dr. Workman to give him a little bit more volume to the cheeks to help correct some of the volume loss that we have once in the mid-face associated with aging. It's a big birthday coming up, so we're going to make him look like he's 18 again, and so he can party on. Alright, so we're going to be using Voluma today. It's an excellent filler for cheek augmentation. It helps to restore volume that has been lost over time. It can help correct flattening of the cheeks. It can help correct elongated lid to cheek line as well. Actually can help bring up some of the lower face that often people come in and ask for correction in the lower face when actually what they need is mid-face correction. So I'm going to use Voluma today. I've already had him numbed with some BLT cream, which is bupivacaine, lidocaine, and tetracaine topical cream that we have compounded by a pharmacy here in town, and it just helps to make the experience a little bit more pleasant. He's icing now as well to help with any discomfort and help minimize bruising. The other thing too is the Voluma has lidocaine in it, so it can help make it that much more of a comfortable process for him. Alright, you ready?
I'm ready.
Alright. We're going to leave this little bit of that arch there. We're going to go above it and get some traction. Here's a pull. Voluma is injected deep dermal and down to periosteum, so you can get some great structural lift with this. Big poke with this product. And in the process, you can get the lifting. And then another poke here. 1, 2, 3. Good job. Then we'll smooth the area out as well. Swelling is not uncommon. Anytime you have a needle involved, you can have some swelling for a few days. Bruising, we like to minimize that as much as possible, but once again, anytime you have a needle involved, that can happen as well. Alright, cleaning the skin again with some rubbing alcohol because I've touched it. We want to maintain aseptic technique. And we're going to go in again. Are you ready? Here we go. Perfect. Okay. So with Dr. Workman, he had more of a depression in the lateral aspect of the cheek that we're going to correct to give that volume. And now that we've corrected that, we're going to move more into a little bit of the mid-face, more closer to the nose, and then we'll also under the area we treated just to give a nice chiseled cheekbones. All right, there we go. 1, 2, 3. Voluma is indicated to last 2 years. Which out of all of the hyaluronic acid fillers is the one that has the longest life. How's the discomfort, Dr. Workman?
All in all, it's pretty good. Just like a little teeny tiny tenth of a bee sting, but after that, it's been really good.
Good. All right. I have an area where I have a little bit of a area I want to soften out a little bit more, closer here. So I'm going to have one more poke up a little bit higher. And there's a poke. There we go. Lumps and bumps can be felt with this type of injection because it is deep and the product is injected more into aliquots. However, the beautiful thing about this product is that it all blends nicely together and we'll do a follow-up picture with him in about a week, 10 days, and be able to see how nice and smooth his cheeks look. Okay, just one moment. Okay, I'm going to come around and do a little bit more onto this way.
Okay.
All right, here she is. Just wipe the skin down a little bit again. Good. How are you doing? Well, that's exciting.
So think of what your song would be. Good.
Here we go. 1, 2, 3. These injections are injected more into a thread-like pattern to give some of the volumizing in a more natural appearance. Poke here. Hopefully you're starting to get even a little bit more numb from.
That's actually the worst one. Look at that.
How much, what do you want to do that day? Okay, let me see. Yeah, right about 4.
I just wanted to do just a bit.
I'm on that for a second.
Last poke. Sorry. Okay.
I'm alive and doing fine.
I'm going to rub the cheeks out some to give a little, help smooth the product into place. The nice thing about this product is that it works beautifully for cheeks and is one of the best products on the market for cheek augmentation. When we augment the cheeks, we help lift up sagging skin that can affect the lower face, jowls, nasolabial lines as well. And it can also help volumize around the eyes without treating the tear troughs. With that, it can help soften crow's feet and give more youthful look to the eyes. Okay, going to the other side now.
All right.
All right, so we're going to go ahead and do the right side of his cheek. None of us are symmetric. This cheek, however, was quite a bit different than the left in that we have a lot more definition and volume on this right side. So often it doesn't need quite as much correction. So we'll be correcting and creating more symmetry. But I think it's going to look really nice. This has given a nice chiseled, increased, volume look to the face. Very masculine.
Yeah, we've had a couple calls from Hollywood already.
Oh,
yeah.
Well, good. You want me to be your booking agent?
Yeah.
All right. This side has also been numbed, iced, and then also aseptically cleaned. All right, we're going to put a little traction, and here we go. 1, 2, 3. Good. And here we go. 1, 2, 3. Some of those ones on the going out closer to the hairline can have a little bit more of a bite to them. And 1, 2, 3. One, two, three. Multiple ways you could use filler into the cheek to help create some of this volume. Some people want more of a cheek definition. Some people just want more volume in itself. So it's always fun to talk with the patient and find out what their preferences are. Some people, for example, like lips, I think are the most subjective area. I think then cheeks are the second. Some people really like really full cheeks here. Some people want more definition. Some people just want more roundness depending on their face shape. So it's always good to have a good consultation. Kind of go over that. Another poke.
There's so many I can't finish.
That looks good. This side a little bit more comfortable? Or
I
about
think
the same?
so. Slightly less.
The topical numbing has had a little bit longer chance to sit on you, so that can always be. Some injectors will use a cannula to do cheeks, which can be a great technique. I prefer the syringes, just because that's my own preference, but have used cannulas, so it just depends on consulting and finding out different preferences and individual needs.
Oh yeah, you said you looked for frames, huh? I know, right?
Okay, one more poke up a little higher. But correcting mid-face volume loss is often overlooked. Most people focus down on the lower face. When we can correct some of this mid-face, it can often just be a dramatic improvement. The other area that can often be missed is the temples and temple hollowing. And even putting filler in that area can help give a more natural, youthful look as well. And that area is another area that can often be overlooked. I'm going to poke here, 1, 2, 3. Okay. Step back and take a look and compare. One more up a little bit higher, and I think you're done. Winner, winner, we have chicken dinner. There you go. Let's take a look. So the nice thing is we now have some improved definition through the zygomatic arch and through the cheek here. It will give also in photographs, light settings, we now have a place for light to hit as opposed to when cheeks lose their volume, it doesn't have a place for light to reflect. So eyes can look heavier, longer, darker, where this allows the light to reflect and make things look brighter, more youthful. So post-care ice, 10-15 minutes a time, 3 to 4 times a day. Keep the head up for at least 4 hours. You can do some gentle massage as indicated by your injector. With him, I don't know that he's really going to need anything, but if anything, it's going to be more of just like a little bit of a swoosh up along that area. And then anticipate potentially a little tenderness, but no heavy exercise for 24 hours, no alcohol for 24 hours, and avoid aspirin, ibuprofen as possible for the next few days as well.
Good.
All right, we'll recheck back later and see how it looks in about 10-14 days. Hope you guys have a great day.